A question that some folks ask, but I think most people know the answer to this is, can I develop cataract after RLE surgery or cataract surgery? And the answer is no. Um, the cataract is the lens, and the lens is what we remove as one of the first steps of cataract surgery or RLE surgery. Again, those two are basically the same surgery. So we remove it in its entirety, and it can't come back. You won't grow that back. Now, what can happen, and almost inevitably will happen, is after the lens is implanted into the eye, the lens induces scarring and scar tissue around it. It's how the lens settles and stays put in its proper position inside the eye. And this process can continue. And so that scar tissue that forms around the lens, and the lens is designed to scar and settle into the tissue, can scar into the optical zone of the lens behind the lens. Now, the scar tissue, so to say, is essentially epithelial cells. These are cells that are lens fiber cells that can migrate after the surgery, but they have to grow on your own tissue, basically a basement membrane, such as the posterior capsule, anterior capsule. It can grow on the lens because the lens is an artificial material. It's seldomly, if ever, I don't think I've ever seen it grow on the surface of the lens or even behind the lens. But these cells can grow on the surface of the posterior capsule, which is behind the lens. This process is highly variable. So if you heal robustly, you may get this is called a posterior capsular pacification sooner than later. So if you're younger and you heal very robustly, you may see this well within 1 year after surgery. And what we do is we simply just take a laser and in 10 to 20 seconds quickly remove all of that scar tissue. Once it's removed, it can't grow back. Recall I said this material can't grow on the surface of the lens. It needs your own tissue to grow onto. But if we remove your own tissue, the posterior capsule, well, it can never grow back. Well, never is a strong word, but I've never seen it grow back. For folks who are older, let's say in their 80s, 90s after cataract surgery, this process is much slower. So you may be 5, 10, 15 years after surgery and not had to deal with the YAG laser to remove the posterior capsular opacification. So it is a case-by-case basis. It all depends on your eye and how it reacts to the lens inside it. But yeah, once we've removed that posterior capsule, also it's misnomer is a secondary cataract. Well, it's not a cataract. It was just simply lens fiber cells growing behind the lens. So once we've removed it, you should expect your vision to be as good as it was, very after you recovered from the original surgery. So hope that helps. Thanks.